Hello everyone, my name's Jess. I'm going to be talking about or teaching about a respiratory focused assessment. In this case, we'll use a 33-year-old male who has had a cold for a couple of weeks and feels like his breathing is declining. So the first thing you're going to be doing is as soon as your patient walks in, you're going to be talking to them, ask them how they're doing, your general open-ended questions like we've been taught. And while you're doing that, you're going to be looking for signs of respiratory distress, cyanosis. Are they having any asynchrony while they're breathing? Are they labored while they're talking? Were they out of breath when they came into your office? And just sort of their general appearance. Are they comfortable? That sort of stuff. The next thing you're going to do is you're going to, of course, do your vital signs, so heart rate, respiratory rate. I like to take the pulse and do the respiratory rate at once so that they don't know that I'm doing the respiratory count, blood pressure, and of course temperature. And then next thing you're going to do is you're going to auscultate. So you're going to use your stethoscope, and I saw most of you had your stethoscopes all brand new, so that's really exciting. So for my stethoscope, and I think for most of yours, it sits a certain way. The way that you put it in your ears is with the tips facing forward. That's how you're going to open it, and then you're going to stick it in. And the other thing you want to be mindful of is you're going to be using the stethoscope on bare skin and making sure that you put enough pressure to create a good seal around the base of your stethoscope and the patient's skin. Most of you have the Bell stethoscope, so you're going to be using the larger part of the stethoscope. The other side is to assess for bruits and adventitious heart sounds. So nextly, if you're going to be doing a full assessment, you're going to get your patient in a gown. But most often, if they're just coming in for a respiratory assessment, you're just going to you'll just have them in their normal clothes. So what you're going to do is you're going to try and preserve their dignity as much as possible and expose the least amount of skin possible. And obviously taking into consideration your patient's gender and whether or not they feel comfortable, and maybe giving them an extra blanket or something to cover up as needed. So I'm going to be using my husband as a patient, so he's going to come sit here. And I'm going to demonstrate how to properly auscultate. I'm going to use the back because most often you'll be able to hear the breath sounds best over the back. A lot of people have thick chests, whether you're a woman or a man. The man might be muscular, or any extra skin, flab, whatever, that'll sort of hinder your ability to hear the breath sounds properly. So, all right, so Aaron's going to turn over. And another thing is, if you have cold hands, you're going to want to warm your cold hands as well as your stethoscope, depending on where it's been sitting. Because if you get the little old ladies that come in, or even the old men, it's really not very nice if you're sticking your really cold hands and stethoscope on their bare skin. So I'm going to listen to my husband's breath sounds. So while you're doing this, obviously your patient has to be quiet, but just sort of run through what you're doing to them, get them to take deep breaths as you're doing it. You'll notice that I'm also moving from side to side, not doing one side first and the other side after, because you're going to want to assess each side and lobe equally and at the same time so that you can properly assess any differences. All right, so I start up here, and I'm going to get him to take a nice big deep breath in. Okay, and then again on the other side. Just going to turn the camera here, and then another deep breath. And 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 another deep breath. Good. So that's basically your respiratory assessment. You can also do the front as well. It just depends on what exactly you're going to be looking for. You might want to do the top here and move to the heart as well. If you're dealing with an older person with respiratory problems, you're definitely going to want to assess their heart as well, especially if you're hearing any crackles or wetness in their chest. It could be stemming from some heart failure. So if you'll notice, I was using a special pattern. This is the back here. So you're going to start from the top, and you're going to sort of move out in an outward pattern, going from one side to the next, one side to the next, and then same as you're going down. And then once you've decided what you found in your assessment, then you can go from there and decide the treatment plan. Thanks for listening.